Hi, this is Dr. Jessica. Today we're going to talk about what to do with bee stings. With spring here, we are definitely noticing more bees, so I wanted to give some tips on what to do if you get stung. First thing, make sure and remove the stinger. It's the best if you can remove the stinger as fast as possible, as this will lessen the amount of venom that gets injected into your body. It's best to scrape out the stinger using a fingernail or something straight-edged. A good party trick is to take a credit card and scrape it across the stinger at a 30-degree angle. It's best not to use a tweezer, as when you pull it out, it actually may release more venom into the body. Number 2, immediately clean with soap and water. For most people, the rash is local, about 1 to 2 centimeters in diameter, about the size of a penny, and the redness typically only lasts a few hours. Something that I see a lot in my office are large localized reactions. And you may be asking me, Dr. Jessica, what are large localized reactions? Well, in about 5 to 10% of people after getting stung by a bee, there's a noticeably large swollen reaction. These large localized reactions often get mistaken for an infection or a bee sting allergy, when in fact it is the body's immune response to the venom. These reactions typically increase in size over the first 48 hours, and then they resolve over the next 5 to 10 days. Take a look at this picture for an example. How do we treat these large localized reactions? Well, first, in addition to using cool compresses, you can also try using NSAIDs. That's like Motrin or Advil. If it's itchy, you can try using an antihistamine like Zyrtec or Claritin. And if the swelling's really severe, make sure to talk to your doctor because they can prescribe you an oral steroid for maybe 1 to 3 days. Now, when would you need an antibiotic for a bee sting? Most people mistakenly think that the large amount of redness after a bee sting means an infection and would need an antibiotic, but this is actually not the case. Most stingers are so small and superficial that they don't cause an infection. So this means that getting a tetanus booster or antibiotics are usually unnecessary. Would a bee sting ever cause an infection? It's rare, but sure. Signs to look for would be fever, severe pain, or if the redness and rash worsens 3 to 5 days after being stung. These would definitely be reasons to talk to your doctor, as they may need to prescribe you antibiotics. And lastly, how do we know when to worry about a bee sting? The feared complication of bee stings is called anaphylaxis, and this is an emergency. Anaphylaxis is rare and occurs in about 3% of bee stings. Signs to look for would be fever, anything involving difficulty breathing, swollen lips or throat, and a rash that involves the whole body. If this is the case, make sure and seek medical attention immediately. And also, if you have any questions about this, make sure and talk to your doctor or an allergy specialist. This is Dr. Jessica. I hope you found this helpful, and we'll see you next Monday.